Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Hi, yes, this is nutritional pharmacist Jerry Hickey. I'm the Chief Scientific Officer over here at Invite Health, and I've done several episodes of our podcast recently on vitamin C. One was an overview on vitamin C, and another was vitamin C in the immune system, and then various aspects of vitamin C utility for heart disease, for the brain, for the eyes, for diabetes, for the lungs, etc. Today I want to discuss vitamin C and cancer. Now there's data that certain nutrients and certain lifestyle habits like exercising, getting enough sleep, and a great diet lower the risk of cancers. It's not bulletproof, it's not 100%, but still it's lowering the risk, and that's very important. But there's also data coming out now that certain nutrients help treat cancer in humans. We're not talking mouse studies, we're talking humans, because we're a little bit different than mice. So for instance, fish oils, melatonin, probiotic bacteria, and vitamin D have been shown in several different studies to help cancer patients. Now, bear in mind there's many different treatments for cancer today, and there's also many different cancers, so it's not like one suit fits all. So it's not like vitamin D may help with every cancer, although I believe there may be something to that. There may be something to vitamin D improving survival in many, many cancers. But today we're talking about vitamin C with cancer, because they're showing that there's been individual reports, case studies of people with very severe, basically impossible to treat cancers, that when they infuse them with high doses of vitamin C, they really last longer. I mean, some of these reports have been incredible. But that's not a study, that's a case report. And case reports are important because it's a lead. It gives you a lead is something really beneficial. So recently there was a report, very interesting. It was in the journal Cancer Cell, and it's from the University of Iowa, and how they're giving infusions of vitamin C to patients with different cancers, like brain cancers and lung cancers, and these people are doing better, and there's a reason for that. Now, mind you, you cannot match the amount of vitamin C in these studies or reports by swallowing it. Only a certain amount gets absorbed. The higher the dosage of vitamin C that you swallow, the lower the percentage you absorb, and the shorter the amount of time it stays in the body, because the body starts to dump it out if it's too high in the bloodstream. So to get truly high doses of vitamin C into the bloodstream, you need to give it by infusion. So if you're trying to get 10 grams in there, or 20 grams in there, the only way to do that is by an intravenous infusion. So here's what they said. Clinical trials found that it is safe to regularly infuse brain and lung cancer patients with high doses of vitamin C as a potential strategy to improve outcomes of standard cancer treatments. Here they're finding that vitamin C is one of the things that helps cancer treatment work better. This is once again in Cancer Cell at the University of Iowa. The researchers show how it may work. What they found is that there's a vulnerability, there's a frailty specific to cancer cells that's not in regular cells, where they can't use iron properly, they can't metabolize iron properly. And when you give a super high dose of vitamin C, it oxidizes the iron and it kills the cancer cell without killing a healthy cell. So this is straight from the researcher. It's the co-author of the study, Dr. Gary Buettner. This paper reveals a metabolic frailty in cancer cells that is based on their own production of oxidizing agents. Well, basically what he's saying is cancer cells are frail, and if you utilize vitamin C, it sensitizes the cancer cells to radiation and chemotherapy. In other words, treatment works better. So that's actual treatment. Now let's look at prevention. This is breast cancer. Several nutrients have been shown to likely lower the risk of breast cancer. A bunch of studies, many of them from Long Island, like Long Island Jewish and North Shore hospitals, have shown that fish oils likely lower the risk of breast cancer by a pretty good level. And you didn't need a lot of fish oils every day. Like one good solid dosage of fish oils, one capsule a day, was enough to lower the risk of breast cancer by 24%. They also found that green tea likely lowers the risk of breast cancer. Vitamin D may lower the risk of breast cancer. Probiotics indirectly lowers the risk because probiotic bacteria, lactobacilli, when you swallow them, within about a week they start migrating up to the breast tissue and they clean chemicals out of the breast. These are chemicals that you get from your skin care and your hair care and your toothpaste and your deodorant, etc. There's chemicals in there that are very powerful estrogens that actually inflame the breast tissue. And only certain strains of bacteria can break down these chemicals and remove them from the breasts. So bacteria like Lactobacillus acidophilus, Lactobacillus plantarum, Lactobacillus rhamnosus actually help detoxify the breast. So vitamin C seems to also lower the risk of breast cancer. So here's the Nurses' Health Study. Now that's a large study. And they're looking at premenopausal women, younger women who have a family history of breast cancer. So their mother had breast cancer or their sister had breast cancer. And if they consumed 200 milligrams of vitamin C a day or more, it lowered their risk of breast cancer by 63%. 63%. That's powerful. The Nurses' Health Study, of course, is a big American study. And then there's the Swedish mammography cohort, which is another very large study. But now they're looking at overweight women. And overweight women who had at least 100 milligrams of vitamin C every day had a 39% lower risk of breast cancer compared to overweight women who had less vitamin C every day. So there is some level of evidence that vitamin C, these are not the only studies, but I picked these out because these are large studies. These are well-known studies. Now let's look at stomach cancer. Vitamin C might help reduce the risk of stomach cancer in several ways. It helps prevent toxins from forming from the food you eat, toxic metabolites. It may help prevent certain bacteria that infect the the stomach and small intestine, like Helicobacter pylori, from triggering mast cell lymphoma. So we're looking at stomach cancer and vitamin C. This is the EPIC study. In people with the highest intake of vitamin C, there was a 45% reduced risk of stomach cancer. Now, I take a supplement on top of my food just to make sure that I'm getting sufficient vitamin C because cancer's scary. So here's colon cancer. And they looked at 13 studies that included over 676,000 people, men and women. If you had sufficient vitamin C, supplements, food, it lowered your risk of colon cancer by 19%. Now, they've seen this even in people who are prone to polyps. The study showed that even if you're prone to polyps, if you get vitamin C, you're less likely to have that polyp convert into colon cancer. So it really means something. The other cancer that vitamin C seems to impact is non-Hodgkin's lymphoma, a type of blood cancer. So now let's look at mortality. And let's just explain mortality. There's mortality attached to certain conditions like a stroke, a heart attack, heart failure, cancer. And then there's all-cause mortality, which is dying from anything. So we're looking at mortality, scary thing, but have to think about, hey, what's going to protect me? I'd like to stick around. See if George R.R. Martin ever finishes up that Game of Thrones saga. So this is a large cohort study. It's the vitamins and lifestyle study. It's over 55,000 people followed for 10 years. So that's a big study. We would call that a well-powered study. Plenty of people, many years. Vitamin C as a supplement not from food, reduced the risk of total mortality. It wasn't a huge reduced risk, but we're talking total mortality. Now, total mortality could be anything. An accident, so maybe you're more aware of things if you have vitamin C because it's needed for your vision and your brain and your muscles and your nerves. Suicide, dying from a virus like the flu or a cold, diabetes, whatever it might be. Vitamin C reduced the risk of total mortality if it was a supplement. So let's look at a meta-analysis because that's even more powerful. Now we're looking at 10 prospective cohort studies because that's really the only way you can look at something like this. A prospective cohort study, you get a large group of people, you put them together, you give them physical checkups, you look at their diet, you look at their drugs, you look at their supplements, you look at their risks, all these different things, and then you follow them for many years. And you see who developed diabetes, who developed Alzheimer's disease, who developed lung diseases, why. And you get a lot of clues out of cohort studies. It really gives you powerful clues as to what you should really knuckle down on and really study. For instance, the Framingham study was where we found out about cholesterol. The Framingham study up in Framingham, Mass. So that's big clues, right? That was a big ongoing prospective cohort study. So this is an analysis of cohort studies. They took 10 huge studies. Now, out of these 10 huge studies, there was approximately 18,000 women who developed breast cancer. If they got a lot of vitamin C, and it could be either from food or a supplement. So once again, if they got a lot of vitamin C, it reduced their risk of dying from the breast cancer. And it reduced their risk of all-cause mortality. Because, once you get cancer and you get treatment, your immune system isn't working well, so infections become more dangerous, etc. Sometimes the treatment messes with your blood vessels, and you develop heart disease. So, 10 prospective studies and a meta-analysis, approximately 18,000 women who had breast cancer. If they took a vitamin C supplement, or if they consumed a lot of vitamin C, it reduced their risk of dying from the breast cancer or dying from all-cause mortality. So now we're back to that Epic Norfolk study. Yesterday or the day before, we quoted the Epic Norfolk study several times. This is approximately 20,000 people in this part of the Epic Norfolk study. There was a strong inverse association between your plasma level of vitamin C and all-cause mortality or dying from coronary artery disease. So let's talk about that. Coronary artery disease is the biggest killer in the world. Coronary artery disease kills more people than all cancers together. It's the number one killer in America. And after that is all the cancers. And they didn't take people's word for it, like, fill out this questionnaire. How many times a week do you eat blueberries? How many times a week do you eat cranberries? How many times a week do you eat broccoli? No, they looked in their blood. And they found that people with higher levels of vitamin C had a reduced risk of dying from any cause, including coronary artery disease, which is the biggest cause. Now, here's the NANES survey. The NANES survey is a periodic survey of Americans. You get a tremendous amount of research out of this, a tremendous amount of data. So in one of the NANES surveys, they looked at the concentration of vitamin C in people's blood serum. And they found that people with higher blood levels of vitamin C had a reduced risk of dying from cancer. But they also had a reduced risk of dying from any cause, all-cause mortality. Now, a couple last things. Then we're going to finish up on vitamin C. Asthma. There's asthma, and then we used to call it exercise-induced asthma. But now they call it exercise-induced bronchoconstriction. It's not the same as asthma. Vitamin C helps prevent you from developing bronchoconstriction related to exercise or cold weather or asthma. It helps keep your lungs open. Somehow it helps aerate your lungs. Lead toxicity, that's important. Vitamin C and vitamin E interact in certain pathways through the liver and kidneys to remove toxins from the body. And one of the things vitamin C is strongly connected to is lower levels of lead. Now, lead's all over the environment. They used to use lead in pipes. Lead was in gasoline. Lead was in paint. And it's persistent. It's a persistent pollutant in the environment. The highest concentration of lead in most people's homes is right by the front door, right inside the front door, because you come in off the street, it's still out in the street from all the gasoline, etc. You come in off the street and it's on the bottom of your shoes. So the highest level of lead is right by the front door. Vitamin C, again and again and again, strongly correlated with lower blood concentrations of lead, lower levels of lead in the body. Somehow it's getting the lead out of the body. Plus it helps prevent lead from damaging the eyes and the brain, etc. Lead damages the brain. It literally lowers your IQ. Lead damages the heart. Lead damages the liver and kidneys. Lead causes high blood pressure and heart attacks. It's very, very toxic. It's extremely toxic. When you look for lead, I mean, obviously the best way to check for lead is to look in the blood. But lead, like you'll see that people with elevated lead, they have like a black line around their mouth, or like their wrist is drooping. It really affects your muscles and your nerves, etc. It really builds up in the body. By the way, if you're older and you built up lead in your body when you were younger, and now you're losing bone, you're developing osteopenia or osteoporosis, that means the things that have been building up in your bone over your life are getting excreted into the bloodstream. The lead is getting released from your bones. One of the places in your body where lead is stockpiled is in your bones. So if you have osteoporosis or osteopenia, you might find that your lead levels have increased. Vitamin C becomes important in it. And by the way, another supplement that helps get rid of lead is NAC, N-acetylcysteine, a very safe supplement that attaches to and chelates heavy metals out of the body, like arsenic, lead, mercury. Very important. Also, there's a drug called Chemet that's it's very safe. It strongly attaches to lead and pulls it out of the body. Lead and mercury. Now, what about safety of vitamin C? Some people think that vitamin C creates kidney stones. I don't buy that. Yet, if you're prone to kidney stones, keep down your vitamin C intake just to be safe. See, vitamin C helps you get rid of oxalic acid, and oxalic acid is the major cause of most kidney stones. That doesn't mean that vitamin C causes kidney stones. Also, as far as vitamin C toxicity, there is zero reliable scientific evidence that vitamin C is toxic or detrimental to your health. There is zero. I mean, it's just not there. So vitamin C is very safe. It has so many functions. It's such a healthy. Smokers need extra vitamin C. Diabetics need extra vitamin C. If you live in a polluted area, you need extra vitamin C. If you're exposed to lead, you need vitamin C. If your immune system needs a little push, you need enough vitamin C for your immune system to be activated to fight viruses. Very important right now. Older people need more vitamin C. Thank you for tuning into the Invite Health podcast. You can find all of our episodes for free wherever you listen to your podcast, or you could go to invitehealth.com/podcast. Please make sure you subscribe. Please leave us a review, and you could follow us on all those social media things, Facebook, Twitter, Instagram, or at Invite Health. I'll see you next time on another episode of the Invite Health podcast. Thank you so much for listening.